Welcome to Banking on KC. I'm your host, Kelly Scanlon. Thank you for joining us. With us on this episode is Kris-Ann Carduff, the account manager for the Community Blood Center of Kansas City. Welcome, Kris-Ann.
Thank you.
You're doing such important work, but for our listeners who might be unfamiliar with the CBC, the Community Blood Center, what's the scope of your work, especially in Kansas City? I know you're part of a larger group, which you can talk with us about, but the scope of your work in Kansas City and what's your role in making it all come to life?
Perfect. So Community Blood Center has been around for a very long time here in Kansas City. And our goal is to supply the regional hospitals with blood. Mm-hmm. So they rely on us. We supply 97% of the hospitals in this region.
Really?
With the blood that
comes
they
from
need.
your organization.
Yes.
Wow.
One of the things that I wanted to make sure people know today is how important it is, because there's no substitute for it. We as humans have to save each other, and there's a shelf life to it. So there might be a lot of people like, I'm being called by them all the time, or I see, every day it seems like they're asking for more and that it's critical, and it's not hyperbolic. It's real.
Isn't there a difference between there's platelets and
platelets, plasma, and whole blood are the three that you'll hear the most. Whole blood's what when you're at a drive, if someone's having a blood drive at your church or at a community or in a building here at like Country Club Bank does, the majority of that is whole blood. So we're getting the red blood cells, and then we take them back to the lab and we test it obviously for safety and split it up in the way that it can then go in as products to what the patient needs.
And what is the demand? You provide 97% of it. Talk about constantly replenishing, constantly.
The statistic is like every 2 seconds in America, someone in the United States needs blood. Blood is needed for obviously traumatic situations in the emergency room. There's also platelets are required for cancer survivors or people who are battling cancer. Another really amazing statistic is 1 in 83 women giving birth are going to end up in a situation where perhaps there's hemorrhaging or they might need units of blood during that process. So also just a standard surgery might need blood.
So it's not just one thing. You might think of the accidents or whatever, car accident, but there's a lot of it's just ordinary, everyday. Routine kinds of medical.
Exactly.
Yeah.
So it's a game of making sure that you have the right supply at the right time and having a consistent supply that the hospitals can rely on. And then if there's anything traumatic that happens, I'm thinking about the people in Texas right now who are dealing with that flood. When something like that occurs, then the demand is even higher, and it's amazing. People usually step up in a situation like that.
Yes, exactly. So what is your role in all of this?
So my role is I'm an account manager. I'm a liaison between our chair people at different businesses and churches and communities that want to put on a blood drive. My role is to help them put on that event the best as we can. So I help them with the communications and marketing it. I supply them with all what's needed to just put on the drive and help them with the education. What we really need from our chair people is the circles of influence, helping us reach out to new people that maybe don't even know or aren't even aware. I know personally, before I worked here, I knew that there was, blood drives. I had seen them, but I had just never really paid much attention. It hadn't impacted me personally. So because of that, I really wasn't aware. And now I have this whole new world opened up to me. And I'm like, oh my gosh, I'm now a donor for life, obviously. And every single person that we can convert, educate, have them understand why we need this, it's just amazing.
So I've read somewhere that every blood donor with their donation can save up to 3 lives each time they donate. And yet there's only a small percentage, also 3% of eligible donors actually give. So how can you help us understand the real measurable impact that the Community Blood Center has on our region, and maybe provide some numbers that bring it home?
62% of the population is eligible to give, but only 3% do. For any reason. It could be, again, just not aware. It could be fear of needles. There's all sorts of reasons. But those 62% that can, we'd really love to get a hold of them. Because there's also, you can only give so often, right? We care about the safety of the donor as well. So for a whole blood donation, you're able to give every 56 days, roughly. So
every couple months.
Yes. Yeah. About 8 weeks. So that is great. And we love it when people get into the routine. Obviously the more you can become a regular donor, the better. Our job is to try to get more of that 62% to know. I think a lot of people think they can't give. So some of the myths that I've heard are, oh, well, I had low iron. I tried one time and they said my iron was low. Well, that's a one time. However, most people it is, if you eat the right foods and you're drinking the water and you're doing certain things leading up to your donation, that
you're going to be fine.
Yeah, you're going to be fine. And your iron could be low one day and the next day it would be fine. So we always encourage someone who heard at previous, if they were deferred, as we call it, they were unable to give on that day, to come back and try again. There might be something that's different.
If you had 30 seconds, okay, I'm going to give you 30 seconds. If you had 30 seconds with someone's on the fence about donating blood, what would you say to them, not just as a professional, but as a person to person?
Yeah, I would say, I get it. I was that person also. I tried in high school. I remember on the journalism and on the yearbook, trying to even just take pictures of the blood drive for our yearbook made me queasy. So I understand that. However, once it impacts you, once you've been in a situation where someone you've loved has been in a car accident, or you know someone who's battling cancer, or anyone who's ever given birth, would you put it into the context of those being the people that you love, this few minutes with this needle in your arm is just nothing compared to what those people have gone through that have been in those situations. So I feel like it's easy for me to put that aside. And then I tell everyone the greatest thing you can do is I like to go to the beach, is what I call it. So I get when I'm there in a nice comfortable bed and I put my arm out, I'm like, okay, hold on a minute. And I turn the other way. I look at the opposite way. I have my AirPods in and I listen to a nice compelling book, or I mentally just put myself at the beach, and then it doesn't really matter because it takes about 10 minutes. If you've drank a lot of water and your blood's flowing well, it can take 10 or 15 minutes. I think that was the thing that was really a misnomer. Was I visualized I was almost going into this hospital environment and I was going to be there all day. And it's not. We make it as comfortable as we can and we get the procedure out of the way as fast as we can.
And I mean, you can go to the blood center and donate, but for the most part, you can do it from your workplace during a drive, from your church, from, wherever it might be, very familiar places.
Yes.
Exactly. Now, I mentioned earlier that you're part of a larger network. Talk to us about that and the benefits of being part of a broader organization.
Yes. So we, about 5 or so years ago, were brought into an enterprise with the New York Blood Center. And what's amazing about them, they're kind of famous up in the Northeast for some of the research that they have done. And actually, there's been a lot of great research done here in Kansas City. The closer we can get to the donor and the recipient match, the better it is for the recipient.
And I suppose that best practices are shared between you and others in the network and so forth.
Yes, absolutely. Yeah. And then if for any reason there were a tragedy in one region, we could jump in and supply and export what we need to them.
The strong partnerships that you build with hospitals, corporations, you've mentioned your relationship with Country Club Bank and other community organizations. So what makes a partnership with Community Blood Center successful? And how does CBC build trust in a space where the stakes are so high?
What I love about it is there's something in it for everyone. We obviously need to collect blood to save lives. That's the number one mission. However, we can be helpful and beneficial to our partners as well. So I like that putting on a blood drive is a great way to show off your business. Maybe you have a brand new, beautiful hotel or another bank branch that's lovely and you want to bring people in. And it's hard sometimes to get people out of their houses these days, right? We've all become very comfortable with being able to have everything come to us. And having a blood drive is a great way as a business to show your community support and that you believe in each other and you want to bring everyone together. I like also that it's an opportunity for a business to maybe find their next leaders in their company. They can put them in charge of this blood drive and find out how they do as putting on this an event and bringing in people and showing their leadership skills with a committee.
Good point.
Yeah, there's a lot of benefits to anytime you put on an event such as this.
You've kind of talked a little bit about some of the changes in the last 5 years, but let's go a little deeper. How has blood donation and the donor experience itself changed in recent years? And what are you doing differently today that might have seemed impossible 5 years ago? I know you mentioned the research and the breakthroughs there, but what are some of the other things that you're doing differently, especially when it comes to the donor experience?
I think there were a lot of myths and misnomers, and we, over the years, have been better at testing blood, so we don't have to turn as much blood away as we maybe did in the past. There used to be a lot of fear of tattoos, right?
Yes.
And then now it's so commonplace. We, as a collectively, not just Community Blood Center, did enough to figure out that their tattoos are not something that has to be a deal breaker.
There is a constant need for blood, like you said, the leukemia patients or for just routine surgeries and so forth. So this constant need, how do you keep people engaged year round? What messaging have you found really works well to keep it top of mind?
For example, 9/11, we had a line out the door.
Oh, sure.
Everybody has their 9/11, their personal one. There's someone who if something is affecting them as strongly and as powerfully as that hit all of us on a daily basis. And that's something we really need to keep in mind. Everyone knows someone too, especially in this new world that we're in. I mean, cancer is becoming so prevalent. We need people to always be thinking about the fact that there's someone who needs this, and you think, oh, well, somebody else will do it. But that somebody else might not be able to do it.
Yeah. So you keep the messaging personal, but you focus on the positive outcomes.
Yes. We do a lot of in honor ofs and of people who have battled cancer and have survived it, and they realize this is their way to give back, to say thank you to all the people that helped them. And it doesn't cost you any money to put on a drive, right? You just open up the doors and tell your friends and family and coworkers, and then we'll come in and do the rest. So I like that we try very hard to make it super easy for you to host a drive and bring people together.
Yeah. Not everybody might be able to run into an ocean and save a drowning child, but you can sit on a bed for 10 minutes and focus on, like you said, an audiobook or something and save 3 lives.
Exactly.
Yeah.
It's easy in that regard. Yes.
You were talking earlier about some of the myths, why people think they can't get blood. How do you reach people who might have misconceptions about whether they can give?
We do a lot of community events and what I call tabling, just showing up and answering questions. You'll be surprised when you ask someone hey, can you be here, and you invite them to give, and they'll tell you, oh, I can't because of this or that. And that's a great opportunity for us to educate and say, actually, I had someone who thought because he had yellow fever when he was 9, he can't give. And I said, actually, your blood's recirculated a lot of times over the years, and that is not a barrier. We have a medical hotline that someone can call and anonymously talk about what they think might prevent them from giving, and we can share with them whether that's true or not. There's a lot of medications. People think just because they're on a medication, it's an automatic knockout, and that's not true either. We want to make sure it's safe for the donor. We don't want them to be doing anything that would jeopardize their health.
What innovations or partnerships are you excited about that could reshape how your organization engages donors and meets local needs?
I think the more we partner with different community leaders and help with the education, that's the key. Because let's face it, we hear what we want to hear. We trust what we hear when we hear it from someone that either has had the same experience as ourselves or looks like us. People in Kansas City will know the name Joanne Collins.
Sure.
She was a councilwoman. Her resume is a mile long. She's an amazing human being. And she's turning 90 this year.
I know, I heard that.
And we're so excited because she's asking her friends and her family to come out and do a blood drive. It was August 16th. Most of the time, people start promoting their blood drive within about a month of or 3 weeks, really about the week before. She's already got 84 people who are like, wow, where do you want me?
Yeah, that's great. That's great.
They're lining up. And that's the kind of beauty that we as a community, that's what I love about Kansas City.
Well, and then you've hopefully, after this one influential person attracted 84 people, you've got 84 new advocates out there too.
It's just the 84 we know about today. And we got 2 months still. But yes, think about how many people that will hear her message that have never maybe even been introduced to this before.
Exactly.
In there, you can give as young as 16 with a parental consent, and then 17 on, we anyone can give. But I would just love it if the people that know Joanne personally bring their family and their children, and we might see this amazing, news. I'm really curious to see how many new donors we get out of it. I'm
sure you will get a substantial number.
Yeah.
It sounds like it anyway. So for corporations, for schools, for other organizations that might want to partner with you, what's the best way to get in touch with you?
The CBC is savealifenow.org. That's our website. Contact me through the website. There's 10 account managers like me. They're all over Kansas. We go all the way out as far as Council Grove, and we're north as St. Joe, and all the way up to the borders of Nebraska and Iowa and down in Missouri. So we're all over, and we're here, and we want to help you put on a drive. And especially if there are kids out there that are looking for scholarship money to help them get to college, we can show you ways to put on a drive, get your leadership skills honed down, all that good stuff. So if you want to put one on, we'll find a way to help you make it happen. That's for sure.
Savealifenow.org. Go out there. You can contact Kris-Ann through that site. There's success stories on there. There's testimonials. There's all kinds of interesting information on there that will help you put on a good drive. And so savealifenow.org. Thank you so much for coming on the show and talking about this wonderful organization and all the work that you do behind the scenes. People take blood for granted. It flows through our veins, but we need more.
Yes, and you make it really fast. So go ahead and give some of it to us, because you'll make more, I promise.
Thank you so much.
This is Joe Close, president of Country Club Bank. Thank you to Kris-Ann Carduff for being our guest on this episode of Banking on KC. Kris-Ann shared how the Community Blood Center of Kansas City supplies 97% of local hospitals with life-saving blood, and why regular donors are vital to meeting constant and diverse needs, from trauma patients to cancer survivors. Her work bridges communities, dispels myths, and invites all of us to step up and save lives. Country Club Bank is proud to partner with organizations like the Community Blood Center that build strong, healthy communities through collaboration and compassion. Thanks for tuning in this week. We're banking on you, Kansas City. Country Club Bank, member FDIC.